One of the most important things we can do is to make sure we have broad vaccine coverage in all regions of the province and in all eligible groups and as high as possible. High vaccination coverage and completion of the 2-dose vaccination series is important to protect Ontarians from the most severe and transmissible Delta variant. I also want to celebrate and congratulate the great work of all those involved in the Toronto Vaccine Day on Sunday, where a record-breaking 26,771 doses were administered at one clinic. Also, to everyone on Monday, June 28th, when 265,000 immunizations were given across the province in one day. These are great numbers that deserve to be highlighted and recognized. To all the volunteers and to everyone that showed up to get vaccinated, thank you. Thank you for your patience and booking and taking advantage of the first appointments. And to the millions of Ontarians who have rolled up their sleeves since the beginning of this vaccine rollout, thank you. The importance of getting vaccinated has never been more critical. We all want a safe opening as we move into step 2 and into the fall. We need to keep this momentum going as we loosen more restrictions tomorrow and going forward. So tomorrow we will enter step 2 of the province's roadmap to reopen, while outdoor activities will be further expanded and some indoor services with small numbers of people will be resumed. It must be done with caution and care. Must listen to the data that Dr. Yaffe just presented to us on the risk of Delta and its potential rapid explosive outbreaks in various areas of the province. This does mean that most Ontarians can get a haircut and are allowed to have family visits or visit their favorite amusement park. It does not yet mean we are ready to forget about the need for physical distancing, masking, and vaccination. We want to ensure that the gains we've made are maintained and that we do not step backwards in our reopening efforts and once again impose restrictions. We must learn what's going on internationally in Australia, in Israel, and in Europe. Stepping forward is the direction we want to take, not stepping backwards. For schools, this is critically important as we look forward to the fall and our hopes for the upcoming school year. Today is the last day of school for most students and teachers across Ontario, and I'm sure this is a day they won't forget. I want to commend all educators and all students for the incredible job they've done over the last year and to be able to provide the best education under very difficult circumstances. And to Ontario's students, thank you for your perseverance through these challenging and stressful times. You've been nothing short of remarkable. But I'm hopeful that you will not have to go through this to the same extent in the future. Our vision for the fall is that you can return to a safe school environment that's as close to possible as the pre-pandemic normal, and we are working closely with our colleagues at the Ministry of Education and to all partners to determine how we can do that safely. It's up to all of us, every Ontarian, to keep our community risk and community rate of infection low so that we can all open safely. So on this day, the last day of school and the eve of Step 2, I want to remind all Ontarians there's 3 basic tenets that we all have to take advantage of. Number 1, if we develop any signs or symptoms of COVID-19, we must get tested. That allows public health to do the great work of case and contact management to try to find the source of the infection and try to limit the spread of infection in every community. Number 2, get vaccinated as soon as possible. Thank you to all Ontarians that have come forward. We're making very good progress. We need to keep up the momentum for first and second doses. And I'd like Ontario to achieve one of the highest immunization rates in the world if we can. And we all must balance. We've suffered over the last year and a half. We must balance the mental, physical, and social well-being, enjoy the summer, do it safely, get outdoors, enjoy the nicer weather, do so safely, so that we can have a safe opening of our economy and a return to school in the fall. So we can take questions now.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
Your first question comes from John McGrath from TVO. John, please go ahead.
Doctors, you mentioned schools, and of course, unvaccinated children are going back into some kinds of congregate activities, things like summer camps and daycares. Is this a cause for concern, especially given the prevalence of Delta that you mentioned?
Our teams have worked very closely to provide guidance to summer camps and to daycares. We're providing the best evidence we can to limit the spread of any virus in those settings. As well, your local public health agencies are well versed in outbreak management. We've worked very closely with our local public health agencies, especially those that have a high number of summer camps, overnight camps, to work collaboratively with them to have integrated plans, as well as the Ontario Camping Association. So we think we've created good plans that can be monitored, that will limit the risk in those settings, and we have good case and contact management if and when necessary, if there are cases detected. There will be a risk. It's our job to keep it a low risk, especially in the face of Delta.
Follow-up?
Mentioned last week a plan to get I think you referred to the last 10%, after we get to around 80% people with their first and second doses, plans to really try and, I guess, go that last mile. I'm just wondering if you can describe what that would look like, whether we would be talking about different methods to reach out to people or small teams, going, knocking door to door. What does that look like?
Yeah, so that is the great work that's done at a local public health agency, and it has to be a multimodal method to try to reach hard-to-reach communities. So I can speak particularly of what's being done in KFLNA in Kingston area, but I know this is replicated across Ontario, where some health units have mobile buses. They have mobile teams that are going to shelters, that are going into consumption and treatment sites, that are working with their primary care partners to go door-to-door in some settings to ensure that vaccine is made available and accessible, increasing the ability of walk-in clinics where people don't have to book, but the clinic is available and accessible for them. That last mile that we have to cross to get across the finish line will be the toughest, but the most rewarding. And I'm very assured, because we've worked so closely with our local public health agencies, that they're creating those plans together with their primary care partners, with their pharmacies, as well as their hospital partners, to try to reach those patients, clients, and members of our community. And I think it's going very, very well. That last stretch will take us months. Once we reach the 80, which could be late this summer, we absolutely won't stop there with all of our partners.
Next question.
Your next question comes from Lorenda Redekop from the CBC. Please go ahead.
Hi there, doctors. We've seen the guidance from the federal government for fully vaccinated people. Do you have guidance yet for people here in Ontario who are fully vaccinated in terms of what they can do?
Yes, we have seen the guidance from the Public Health Agency of Canada. And we are working on guidance that will be specific for Ontario. It will be available shortly. Certainly, we were aware of what FAC was putting out, and we were in general agreement with it, obviously, as were all the other provinces and territories. I think that they do emphasize at the beginning of their document that whatever they put forward, you have to consider what the provisions are in your local jurisdiction. So in the local province, in your local municipality or city. So for example, somebody who's in Waterloo may not be able to do what people in another jurisdiction are in Ontario. So, but the FAC guidelines are very good, high-level guidelines for your personal life. We will be releasing guidelines shortly specifically for Ontario.
Follow-up?
I know we're only just on the eve of step 2, but a lot of people are already wondering about the possibility of step 3. What metrics would you like to see, and is that 3-week gap between the steps important, or what would you like to see?
Thank you for that question. I know everyone's following the immunization rate, and that's a very important metric for us, and have to thank Ontarians for all the work they've done to achieve our status at present. But it's only one of the metrics. We're watching hospitalization rates, the impact on our intensive care partners, the number of people that need intensive care requiring ventilation. We're also looking at how fast the virus spreads, so the reproductive rate of the virus, and it is actually increasing at present. As well, we should all remember that it takes at least 14 days after your second dose before your body's building the immunity that's required to fight off these viruses. So we always should be adding that 14-day cushion and then have a period of observation where we're monitoring the health of the population. We're monitoring all of those numerous indicators, not just the immunization rate, to show that we've opened safely, that it's been done effectively, and that is prudent and wise to move to the next step. And with Delta being present, we obviously have to watch what's going on around the world, where Australia and multiple cities have had to lock down. Israel's back with masking in public spaces. Europe may be looking at further public health measures. We're going to be watching internationally, nationally, provincially, locally, being data-driven and advise government based on data. And the 2 to 3 week cycle is very important to maintain so that we do the opening of Ontario in a stepwise manner, always going forward and not having to take a step back.
Next question.
Your next question comes from Nicole Lampa from CTV News Kitchener. Nicole, please go ahead.
Good afternoon, doctors. Looking at the case counts here in Waterloo region, the trends overall have not improved week over week. We're still seeing elevated case counts as well as hospitalizations. Can you acknowledge that, the Delta variant has not let up in Waterloo region?
Well, thank you for that question. And we're in regular contact with the region of Waterloo Public Health. We're providing ongoing consultation and support to them. We're providing additional vaccine, additional nursing support, and guidance to them if and when it's requested. I have all the confidence in their leadership as well as their public health agency to be able to respond to this threat. We know we have to maintain a high testing rate in that area. We have to be able to provide good and rapid case and contact management. At the same time, continue to protect more and more individuals in that region by immunization to ring vaccinate around those high-risk areas. This Delta strain is proving very difficult to control, and it will take a significant amount of work, but I do believe they're up to it. And I also want to give words of encouragement to the community. We know you're making sacrifices. You're making sacrifices really helping all of Ontario by decreasing your social contacts, and sadly having to keep some businesses closed. But those will help all Ontarians because we don't want to see this virus seed off into other areas of the Southwest or back into our high-density urban settings. So please, I understand your concerns in the Waterloo-Kitchener area. This is a difficult circumstance. We're providing all the support we can, and I have confidence that we can get this under control, but it will take time.